Hi, welcome to our PTCB Prep Guide. Today, we are diving deep into anemia. This is a topic you are absolutely going to see on your exam, and for sure in the pharmacy. We're going to break down all the different types, what causes them, and of course, the key medications used to treat them. Let's jump right in.
So, to get our brains warmed up, let me ask you a quick question. What do things like tiredness, weakness, and dizziness all have in common? If a patient comes in saying they feel like this all the time, well, these are all clues pointing to one big underlying condition.
You've got tiredness, weakness, maybe some shortness of breath, and dizziness. All of these feelings point to a single problem, a breakdown in the body's energy and oxygen supply system.
And the answer is anemia. Simply put, anemia is when your body just doesn't have enough healthy red blood cells. Now, I want you to think of red blood cells like a fleet of delivery trucks for oxygen. If you don't have enough trucks, or if the trucks you have are broken, your body's tissues just can't get the oxygen they need to work properly. And that right there is why people feel so completely wiped out. Okay, so to really get a handle on this, we're going to open up the case files on a few different types of anemia. Let's start with two that are all about the actual shape and size of those red blood cells.
So, take a look here. On the left, you've got a normal, healthy red blood cell. See how it's a nice, round, flexible disc? It's perfect for zipping through even the tiniest blood vessels. But then, look at the right. That's a sickle-shaped cell. It's stiff, it's C-shaped, and because of that, it gets stuck. It literally causes painful little traffic jams inside the bloodstream.
So how do we treat this? Well, the strategy makes a lot of sense. We use drugs like hydroxyurea to help reduce those painful crises. Then we add folic acid, which helps the body build brand new, healthier red blood cells. And of course, pain medications are absolutely crucial for managing the symptoms from those blockages. All right, on to our next case, Microcytic anemia. You'll also hear it called iron-deficiency anemia. The name itself gives you a huge clue, right? Micro means small. So the red blood cells are too small, and it's because they're missing a super important building block, iron. So why does this even happen? Well, some common causes are blood loss or the extra demands of pregnancy. And, it's just generally more common in women. At the end of the day, the body's iron supply is just getting used up faster than it can be replaced. The treatment for this one is pretty straightforward. We've got to replace that missing iron. Things like ferrous sulfate or ferrous gluconate are the usual go-tos. But, and listen up, this is a fantastic pharmacy tech tip you have to remember. Always look for vitamin C. Taking iron with vitamin C, maybe in a glass of orange juice, seriously improves how well the body absorbs it. It's a game changer. Okay, let's close out those files for now and open up our next set. These next two are all about anemias caused by other kinds of deficiencies and by chronic diseases. In our next case is Macrocytic anemia. So, if micro meant small, you can probably guess what macro means. You got it, large. In this type, the red blood cells are actually way too big, and because of that, they just don't work right. This is almost always caused by not having enough vitamin B12 or folate. So, no big surprise here, the treatment is just to replace what's missing. We give cyanocobalamin for a B12 deficiency, and we give folic acid for a folate deficiency. It's all about giving the body the right ingredients to make normal-sized red blood cells again. Now for something a little different. With anemia of chronic disease, the problem isn't a lack of iron. The body actually has iron, but because of some long-term illness, it can't use it correctly to make new red blood cells. It's a utilization problem. Yeah, you see this a lot in patients who have conditions like chronic kidney disease or cancer. The body's got the iron, but the illness itself messes with the signals to make red blood cells. So what do? We use a special class of drugs called erythropoiesis-stimulating agents, or ESAs, like epoetin alpha. These drugs basically give the bone marrow a direct order. Hey, start making red blood cells now. Now, these ESAs are biologic drugs, which means they are complex, kind of fragile molecules. And because of that, they come with some very important handling instructions. First pharmacy tip you have to know. These meds must be stored in the fridge. Second, and this is so important, do not shake the vial, ever. Shaking it can literally destroy the delicate protein structure of the medication, which makes it totally useless. And finally, for patient safety, it is absolutely vital to monitor hemoglobin levels. See, if we stimulate red blood cell production a little too much, the blood can get too thick, and that raises the risk of dangerous blood clots. It's all about finding that perfect balance. Let's move on to our last set of case files. And I'll tell you, these are the most serious categories we're going to talk about because they involved either the outright destruction of red blood cells or a complete failure of production. So here we have two very different, very serious problems. With hemolytic anemia, the body's own immune system makes a mistake and starts attacking and destroying red blood cells way too early. Then you have aplastic anemia, which is even more severe. Here, the bone marrow, which is the factory that makes all blood cells, it just stops working. It's a total factory shutdown, leading to a shortage of everything: red cells, white cells, and platelets. And as you'd expect, the treatments are designed for these very specific causes. For hemolytic anemia, we might use steroids like prednisone to calm down the immune system and get it to stop attacking. For aplastic anemia, the plan is often twofold. Drugs like cyclosporin can suppress the immune system in case it's attacking the marrow, while other drugs like filgrastim are used to stimulate the marrow and get it to produce more cells. Wow, great job! We have covered a lot of information. So now, let's put it all together in one final review that's going to help lock all these key concepts into your brain. This table really brings it all home. Look for the patterns, right? Sickle cell is genetic, causes misshaped cells, and we treat it with hydroxyurea. Microcytic, low iron, small cells, so we replace the iron. Macrocytic, low B12 or folate, large cells, so we replace the vitamins. Chronic disease, normal-sized cells but low production, so we stimulate it with apoetin. And finally, hemolytic and aplastic are about destruction or failure, so we need drugs to protect the cells or support the bone marrow. See? It all connects. And that's really the crucial point here. Understanding these differences, the cause, the effect on the cell, the purpose of the drug, it is absolutely fundamental to your job as a pharmacy technician. This is how you help provide safe and effective care for your patients. Okay, let's wrap up with one last question to really test your knowledge. Which anemia drug that we just talked about requires that special handling, and can you name the 3 key pharmacy tips that go with it? Getting this one right shows you're really starting to think like a pharmacy tech. Thanks so much for joining us, and we'll see you in the next explainer.